President-elect Trump has said that he does want to repeal Obamacare. But he also wants to replace it with something that covers as many people, or he said that at least at certain points. Do you think that the dynamic in which you became responsible for what people didn't like is going to hamper Republican movement in their efforts to change a system that maybe they don't like but does have a lot of people relying on it? President Obama, well, let me start from a very simple premise: if it works, I'm for it. If something can cover all Americans, make sure that if they have a pre-existing condition they can still get coverage. Make sure that prescription drugs are affordable, encourage preventive measures to keep people healthy. That makes sure that in rural communities people have access to substance abuse care or mental health care. That Medicare and Medicaid continue to function effectively if you can do all that cheaper than we talked about. Cheaper than Obamacare achieves and with better quality, and it's just terrific. I'm for it. I think that part of the challenge in this whole debate and this is true, dating back to 2009, back to 2010, is this idea that somehow we had a fixed way of trying to fix the healthcare system, that we were rigid and stubborn and wouldn't welcome Republican ideas. And if we only had, they had all these great solutions. In fact, if you look at how this law evolved, and I've said this publicly before, if I was starting from scratch, I probably would have supported a single-payer system because it's just easier for people to understand and manage. And that's essentially what Medicare is a single-payer system for people of a certain age. And people are very satisfied with it, and it's not that complicated to understand or to access services. But that wasn't available, we weren't starting from scratch. So what did I then do? I said, well, where is a system out there that seems to be providing coverage for everybody that politically we could actually get through a Congress and where we could get Republican support? And lo and behold, in Massachusetts there was a plan that had been designed on a bipartisan basis, including by a Republican governor who ultimately became the nominee for the Republican Party that came close to providing universal coverage. And I would have thought, since this was an idea that had previously gotten a lot of Republican support, that it would continue to get a lot of Republican support. And yet, somehow, magically, the minute we said this is a great idea and it's working, Republicans said this is terrible and we don't want to do this. So I say all this, Ezra, simply to make something very clear. From the very start, in the earliest negotiations in 2009, 2010, I made clear to Republicans that if they had ideas that they could show would work better than the ideas that we had thought of, I would be happy to incorporate them into the law. And rather than offer ideas, what we got was a big no, we just don't want to do this. After the law passed, for the last 6, 7 years, there has been the argument that we can provide a great replacement that will be much better for everybody than what the Affordable Care Act is providing. And yet, over the last 6, 7 years, there has been no actual replacement. Law that any credible healthcare policy experts have said would work better. In fact, many of them would result in millions of people losing. Coverage, and the coverage being worse for those who kept it. And so now is the time when Republicans, I think, have to go ahead and show their cards. If, in fact, they have a program that would genuinely work better and they want to call it. Whatever they want, they can call it Trump Care, they can call it McConnell Care, or Ryan Care. If it actually works, I will be the first one to say, great, you should have told me that back in 2009. I asked. And the reason it will not happen is because if you want to provide coverage to people, then there are certain baseline things that you got to do. Number 1, healthcare is not cheap. And for people who can't afford healthcare or don't get it through the job, that means the government has got to pay some money. Number 2, all those provisions that the Republicans say they want to keep and that they like, for example, making sure that people can get healthcare even if they have a pre-existing condition. Well, it turns out that the only way to meet that guarantee is to either make sure that everybody has some modest obligation to get healthcare so that they're not gaming the system, or you've got to be willing to provide huge subsidies to the insurance companies so that they're taking in people who are already sick. And I think what you're going to see now that you have a Republican president-elect. You have Republicans who control both chambers in Congress, is that all the promises they made about how they can do it better. Cheaper, everybody is going to be satisfied, are going to be really hard to meet. And this is why the strategy of repeal first and replace later is just a huge disservice to the American people. And is something that I think, whether you're a Republican or a Democrat, you should be opposed to. These are real lives at stake. I'm getting letters right now from people who say, I am terrified because my sons or daughters. Insurance, their ability to get life-saving drugs, their ability to get drug treatment. Their ability to get mental health services are entirely dependent on us being able to afford and keep our insurance. And if, in fact, there's going to be a massive undoing of what's 1/6 of our economy. Then the Republicans need to put forward very specific ideas about how they're going to do it. People need to be able to debate it. They need to be able to study it the same way they did when we passed the Affordable Care Act. And let the American people gauge, is this going to result in something better than what Obamacare has produced? And if they're so convinced that they can do it better, they shouldn't be afraid to make that presentation. It is really interesting to try to figure out why is it that they're trying to rush the repeal so quick. What is it that they're afraid of? Why wouldn't they want to say, here's our plan? And show, side by side, here's why our plan is better than what Obamacare has produced? Because they have said, absolutely, adamantly, that they can do it better. I am saying to every Republican right now, if you, in fact, can put a plan together that is demonstrably better than what Obamacare is doing. I will publicly support repealing Obamacare and replacing it with your plan. But I want to see it first. I want to see it first. And I want third party. Objective people, whether it's the Congressional Budget Office or healthcare experts across the ideological spectrum, or Vox, or whoever. Mr. Klein, we'd be happy to, yes. President Obama, to just evaluate it. And the public will not have to take my word for it. We can designate some referees. And if they can show that they can do it better, cheaper, more effective. Provide better coverage, why wouldn't I be for it? Why wouldn't I be for it? This idea that somehow, oh, this is about Obama preserving his legacy, keep in mind. I'm not the one who named it Obamacare. They were the ones who named it Obamacare, because what they wanted to do was personalize. This and feed on antipathy towards me in their party as an organizing tool, as politics. But I don't have a pride of authorship on this thing. If they can come up with something better, I'm for it. But you have to show, and I would advise every Democrat to be for it, but you have to show that it's better. And that's not too much to ask. And that's the challenge. And the question right now for Paul Ryan and Mitch McConnell is: why is it that you feel obliged to repeal it before you show what it is that is going to replace? Because the majority of Americans have been very clear that they think that's a bad idea. You now have Republican governors, some Republican senators, who have said, "We don't think that's a good idea." And there's been no real explanation to why you would actually. Try to do this before the new president is even inaugurated. Particularly if you're going to delay the actual repeal. If they were making the argument that this is so disastrous that we actually think we have to repeal it. Completely today because it's just terrible, well, I would disagree, but at least I could understand it. But here you're saying, we're going to vote to repeal. But then we're going to delay its effects for a couple of years. Well, why, if it's so bad? And if the answer is, well, it would be disruptive and we don't want to take people's insurance away right away. Well, then that means you have time to show us and, more importantly, show the American people who need health insurance what exactly you're replacing it with. In that sense, Ezra, I know that was a long answer, but in that sense, the answer is the Republicans. Yes, will own the problems with the healthcare system if they choose to repeal something that is providing health insurance to a lot of people. And providing benefits to every American who has health insurance. Even if they're getting it through the job, and they haven't shown us what it is that they're going to do. Then they do own it. Because that is irresponsible. and even members of their own party. Even those who are opposed to me, have said that that is an irresponsible thing to do.